So now with the biochemistry part, there's a couple of things that I always want my patients to do. Number one, they need to increase their water intake and decrease the sugar. So your body is about like 70–80% water. Okay, our cells all need water. We need to flush all the organs out. We have so much toxicities. Now it's like you gotta figure out which water to drink because there's so many different toxins in the water too now. Don't drink tap, okay? So the recommendation for water is the 1 liter per 50 pounds of body weight or half your body in fluid ounces. So if you weigh 120 pounds, you should do at least 2 to 3 liters, or you can do half your body weight, which would be 60, so 60 fluid ounces, which is about over 1.5 liters or so, okay? Coffee or tea doesn't count as water, okay? Those are actually diuretics. So if you're drinking 1 cup of coffee or 1 cup of tea a day, replenish with a cup of water on top of your, 1 liter per 50 pounds body weight day, okay? So that is like the easiest thing that I try to get my patients to do. A lot of people, they can't do it, but when they do it, they feel better. I had a couple patients like knee pain, low back pain, been telling them for years, can you just lay off the coffee just for this, week or 2, 3 weeks, and then, do the water that's recommended, 2–3 liters, whatever it is, they do it and come back like, my knees feel better, my low back feels better. So it's not a miracle, it's water. But it's so easy to do. Okay, so this is a book written by, his name is F. Batman Geldish. All he did was just case-by-case study on how water affects the body. So he's got asthma, allergies, blood pressure, dehydration, diabetes, constipation, autoimmune diseases, heartburn, hiatal hernia, colitis, headaches, migraines, rheumatoid arthritis, low back pain, osteoarthritis. The list goes on. And it's not saying that water is a cure for everything, but the main problem is that most people are in this world dehydrated. So another thing is you want to decrease your sugar, which is the processed sugar, right? Your breads, rice, pastas, potatoes, all that stuff. That becomes sugar in the body, carbohydrates. So digestion always starts in the mouth. So if you put like a piece of sugar on the tongue, kinesiologists had known since the 1960s that sugar blows out most of the muscles. So we'll show this in a second, okay? Now, along with this are a couple of nutrients that kinesiologists had known as well since the 1960s that blow off certain muscles in the body. Wheat turns off the muscle that relates to the kidneys, okay? Now the kidney muscle is called the psoas muscle, which is like a deep hip flexor muscle that helps us bend. Okay, so that's, if you're a low back patient, wheat for sure you want to stay off of. Okay, corn turns off the muscle that relates to the brain. That muscle is actually called the supraspinatus muscles in the shoulder. Okay, dairy turns off the muscle that relates to the colon. So your colon is your large intestine, which relates to your L4, L5 in the low back, which is big as well. So a low back patient would want to avoid dairy as well. Soy turns a lot of the muscles that relate to the reproductive organs. Okay. So a lot of the reproductive organs actually surround the pelvis. So like your glutes, your piriformis, so any low back, again, you want to avoid that. And then sugar turns off most muscles, okay? So we'll demonstrate this. I'm just gonna test his muscles out and see how he's doing, and then we'll connect the organs, okay? So this is his pec major sternal muscle, relates to the liver. That's nice and strong, okay? That's related to his liver. I'm gonna check the other side because we want to check both of them. That's nice and strong. And Billy's a pretty strong guy. Used to be a kickboxer. So this is his pec major clavicular muscle released to the stomach, and he's nice and strong on that one. That's nice and strong. Okay, so he's doing so far he's good, right? Let's check his kidney muscle. This is the wheat one. Okay, that's nice and strong. He's probably well hydrated. No, that one's a little weak. Try that one. Go. That one's a little weak. Okay, so we have a weak psoas muscle. This is a small intestine muscle, the quadriceps. For sure, go. Nice and strong. Should go. Nice and strong. And then we're going to check one more, the colon muscle, okay? So this is the one that turns off with dairy, okay? So you can kick up and out. Go. Okay. That's fine. Up and out. Go. Okay, so overall, Billy is doing pretty well, okay? So we're just going to stimulate his nervous system, okay? So I know he doesn't eat this stuff on a regular basis. Which one do you want? So all we have to do is stimulate his tongue, okay? So on the tongue you have these things called the gustatory receptors, which are the nerve receptors on the tongue. So digestion starts in the mouth. All we're going to do is have him stimulate the tongue. At that point, the nervous system in the brain is going to know what's going on the tongue and what's going into the body. And then it will outloop and send a signal to the muscle. Yeah, just put a little piece, bite it. Okay. You don't have to swallow it, you can spit it out later.
Okay.
But just got to be on the tongue. So stimulating his nerve receptors. Okay. So now let's go back here. So let's go back to the muscles and see what happens. Keep this locked. Push here. Go. He goes weak.
Wow.
Right? And he's a pretty strong guy. Let's check his stomach. Goes weak. Push here. Goes weak.
Wow.
Push here. And that one actually is still holding strong. Go again. So it hasn't hit his stomach yet, okay? But eventually we'll get there. So let's check these strong quads he has here. Push here, go. He's got nothing. He's got nothing on that one. There you go. He's trying so hard. So let's check the colon muscle. Let's see if it blows out the dairy. Kick up here. Go. That's weak. Kick up now. Go. And it actually hasn't hit that one yet, and he's holding on to dear life. But, but so I mean, actually, it's interesting because so far it hasn't hit the right side of his body. So neurologically, we can actually find the details of why that's happening. But I would probably I guarantee it'll eventually get there. So that in an instant, it should be that fast, okay? Because the nervous system in the brain, it just processes the information that fast. So in the reverse order, though, if we know we have a weak muscle, do you think we can give a nutrient that will stimulate his nervous system and make a muscle go strong? Absolutely, right? So that's actually how Dr. Goodhart did a lot of nutritional testing. So we would find certain vitamins or minerals that can turn on the muscles that were weak for the body. Okay?
So everybody's food tolerance and sensitivity can be different, but this has been shown and tested for most kinesiology patients that we see. And then we can have him hold the test and see if it's strong or weak. And in this case, it's actually going weak. And so that would mean his body's not resonating with that supplement.
Okay, so essentially I don't need the supplement.